When it comes to starting to move so that you can actually improve knee flexion after surgery, it may not be all that comfortable. Much of the lack of knee flexion immediately after surgery is not only due to pain, but also knee swelling in response to the surgery. Inside of your knee is a joint capsule that surrounds the entire joint. Imagine this joint capsule is shaped like a balloon. When there is increased swelling in the joint, the balloon gets bigger. It gets a lot harder to bend the knee with a bigger balloon inside of it. The key to improve knee flexion after surgery is gently pushing into that uncomfortable range and trying to progressively increase the amount of time you spend there with each successive day. What may feel tight and uncomfortable today should hopefully feel less restrictive tomorrow. Each day is a new day. You should expect that some days are going to feel tighter than others, sometimes for no apparent reason. But many times certain parts of the body may feel tighter because you did too much too soon. Remember, minimizing swelling after surgery is goal number 1. If you find that your knee is more swollen after your knee flexion exercises, it means you are doing too much. Scale back the intensity until you find the amount of mobility work that your knee can handle at this time. Besides knee flexion and minimizing swelling after surgery, other goals early in your rehab would also be knee extension, and the most important one is to gain back all the strength and muscle mass you lost because of the inactivity after surgery. This is one of the most important early goals in my eyes. We tend to focus too long on icing and massaging, but trust me, muscle imbalances are your worst enemy. Walking around too long with muscle imbalances will result in other injuries. Another important thing to know is that when I talk about strength, I don't only mean the knee. You should also strengthen the muscles surrounding the knee. I always tell my athletes, the stronger and healthier the muscles surrounding your knee, the less work your knee will have to do, so the more time and freedom you give it to heal. Work on muscles like the hamstrings, the glutes, the adductors, ankles, tibia, quads, or even the calves. A last important message for you guys is, you are your body's best healer. This means that you have the choice to do the right things or jump right back into competition and training sessions, but fall back and restart the whole process. Remember that life is a marathon, always think long term and everything will be alright.